And it isn't just doctors and nurses and travelers who are at risk of getting Ebola, it's also our military. A growing number of U.S. troops are being deployed to Ebola-infected areas. So what is the plan for them when they come home? And is there one? Representative Marsha Blackburn joins us. Good evening, Congresswoman. And what is the plan for our military?
Well, we're hearing that they're going to face a 21-day quarantine. And Greta, we're very concerned about that. I was at Fort Campbell last week and met with the command team. Got some great information, came away with a lot of questions, and have a letter in to the DOD Secretary Hagel right now, trying to get some answers there. But we are hearing a 21-day quarantine is going to be in order for all of our military.
How do you figure that? If we're going to throw one nurse in a tent, I don't know if there are 1,500 over there, we're going to get 1,500 little plastic tents to put them, or I mean, like, exactly, has anyone thought about this? I mean, it sounds great. But, I mean, is anyone that's the whole problem with this administration. Nobody sort of thinks it through. Okay, let's quarantine them. That's a great idea. But how are we doing this? Does anyone plan it?
No, and that is part of the problem, is that we don't know the scope of the mission. We do not know exactly how long they're going to be there. We do not know what the process is going to be. When these men and women come home from that deployment, they need to be able to be home and be with their troops. Now, let's back that up. If we were going to have a quarantine, it would make sense that if we're going to fight Ebola in West Africa, we would quarantine in West Africa, and any of those individuals who are citizens of those countries in the hot zone that want to exit, they would go through a quarantine.
So when we put 1,500 of our military in one room in West Africa, where they spread it to each other, do we get 1,500 plastic tents? I just don't know how to do this.
Right, that's exactly right. But what you need to look at is the opportunity for something like a forward operating base. Our men and women need to know how this is going to be dealt with. They need to know what level of risk they're going to face. If they're out working on a construction site, that may be one level of risk. If they're going to be training medical personnel that are Liberians, that would be another level of risk. We're concerned about who is vetting those individuals. We're concerned about the...
Let me tell you something scary. Dr. Brantley will be joining us soon. I've spoken to him a number of times, and he believes that he did not get Ebola taking care of Ebola patients. He thought that you got him taking care of other patients that weren't in the Ebola section. I mean, our members of the military will necessarily come in contact with people. I'm hoping they don't get Ebola, but it's an infectious virus.
You're right, and that is why we're seeking some of these answers. The health security, personal security of our troops as they are deployed is going to be an imperative. And there are answers about this mission that we want to know. The families want to know. We're in very close touch with those families. And you need that comprehensive strategy that you just mentioned, and you do not have it. You can't treat the military one way and treat individuals that are health workers coming out of the region another way, and Liberian, Sierra Leone, and Guinea citizens a different way, and contain it and treat it.
Totally agree. We need leadership at the top to tell us what we're doing and how we're going to do it. Congresswoman, thank you.
Thank you.